Welcome back to Reality Asserts Itself on the Real News Network. I'm Paul Jay, and we're continuing our discussion about healthcare and more with Wendell Potter. Thanks for joining us again, Wendell.
Thank you, Paul.
So you got to watch the previous segments. You'll get Wendell's story. And let me just mention one more time his book, Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. So we've talked in the previous couple of segments about what's wrong with the Affordable Care Act, Obamacare, that it really benefited insurance companies in the end more than it did most people. Some of the reforms are positive compared to no ACA, but not nearly what it seemed, what it was promising. So the debate in the Democratic Party now is fix ACA, because you can't pass Medicare for all. It's going to be called socialist, which is what the Republicans are calling it, and even some Democrats. And of course, socialism is terrible. Imagine having a right to health care when you're born. I mean, it's kind of funny growing up in Canada, which is not a socialist country, and a lot of people actually wished it was. But that being said, practically part of the Canadian identity is being proud of having socialized health care. But that being said, the politics of the Democratic Party, and I think a lot of this will play out in the primary, will be that fixing ACA is a lot more doable than trying to pass Medicare for all, if for no other reason that the private insurance companies will go to war with the Democratic Party to stop Medicare for all. Anyway, what do you make of this debate?
Well, a lot of Democrats, the ones that I would refer to as corporate Democrats, those who take a lot of money still from corporate interests, including healthcare interest, they're under the influence of the lobbyists for those companies and have been persuaded by those lobbyists that private insurers have a legitimate role to play in our healthcare system.
So under the influence means they're getting money.
Exactly right. They're getting big campaign checks. The Democratic Congressional Campaign Committee brings in a boatload of money from health insurance companies and healthcare providers. So they don't want those checks to stop. So they are, in many cases, not favoring Medicare for all. Because insurance lobbyists don't want that. They're under some delusion that the insurance industry will be more favorably inclined to support some half measure, something that would, for example, create a public option, which is something that the insurance industry will fight just as fiercely as moving to Medicare for all.
Well, let's stop there for a minute at public option, because back in 2009, before the ACA hearings began, you thought a public option should be on the table. Right. It really wasn't. There was a talk of public option. Obama kind of mentioned it, but certainly his heart was never in it. He didn't give it any real play.
Right.
And it got off the table pretty fast. Just a public option, if I understand it correctly, is you could go to these exchanges and you'd be able to choose private insurance. But if you wanted to, there would be a Medicare-style plan you could buy into. Now, since ACA, and more recently, a lot of the advocates of Medicare for all, including like the nurses union and others, they don't want a public option on the table. They think it's kind of a distraction from getting Medicare for all, and they just want this focus on Medicare for all. What do you make of this public option versus just full-blown Medicare for all?
Well, you're right. During the debate on what became the Affordable Care Act, I supported the creation of a public option. The reason was because there was no talk about moving to Medicare for all, for one thing. And a public option was as good as we possibly could get.
Well, there was talk. I mean, Sanders and others were talking about it, but it certainly wasn't on the table in terms of Democratic Party politics of the day.
Correct.
I mean, Obama was against it.
He was against it, although at some time in his past he'd said we needed to have it, and if we could start all over again with a clean slate, that's what we should have. But during his presidency, he certainly was not receptive to any conversation about moving to a Medicare for all type of system. So that's all we could get back then. It was the one thing that I thought might make sure, even as Obama said, as you correctly noted, he was not so strongly in favor of it, but he at one point did say that we needed to have a public option if for no other reason than to keep private insurance companies honest. I agreed with that. This could have possibly have been a way that could have created a new competitor for private insurance companies.
The critique of public option I've heard is that it would allow the private insurance companies to cherry pick. They could kind of force through deductibles and other means people who have illnesses and need a lot of health care into the public option and out of the private option, and actually just increase their profitability.
And that's exactly what more than likely would happen if such a public option were created. Now, keep in mind, they fiercely fought that. They didn't want to have any kind of a new competitor. But if you create a public option, you're just adding to complexity, and you are probably, the way it would be structured, would indeed play.
So you're opposed to that now? You think there needs to be just move to Medicare for all?
Oh, absolutely. As long as you keep private insurance companies in the mix, you're never going to be able to have a system that is less complex and less expensive than the one we have now. Insurance companies are middlemen who serve no real purpose in this country. A few years ago, before I left my job at Cigna, I was in a leadership meeting with the CEO. One person asked him, "What keeps you up at night?" And he said, disintermediation, which was a term that we all almost had to look up. But he said that what he was afraid of was that the company's customers, their employers in particular, employer customers, would come to question the value proposition of private insurance companies. And we've reached that point now. In other words, we have reached the point that employers are looking to disintermediate, to get rid of a middleman in this healthcare system. They add cost rather than remove cost from the system. They are barriers for people to getting the care that they need. So it has to be eliminated. There is no way that we're ever going to get our cost under control or get anywhere close to having majority of our, more of our people covered, as long as we have private insurance companies in the mix. I'm confident of that.
Okay, I think it's worthwhile giving a little historical context here, because most of the industrialized world has one form or another of a government health insurance plan and has little to no private insurance companies, but not the United States. So let's talk a little bit about the history. If you could look at the development in Canada versus U.S., there in the late 50s, 60s, you have in the province of Saskatchewan with Premier Tommy Douglas, brings in a government health care plan in one province. And it becomes very popular, and there's a big fight eventually to have a nationwide plan. But that fight is not so much with private insurance companies, because if I understand it correctly, they're mostly nonprofits. The fight is actually with the Canadian Medical Association.
It was.
And with doctors, who, interesting enough, now the majority of doctors actually love the healthcare plan, because unlike the British system, they actually are still private. Most doctors, although hospitals are public, most doctors have private practices and work with a very regulated government health insurance plan. But why didn't that happen here? When it makes so much sense, even for big industries, like one of the big supporters of the Canadian healthcare plan was General Motors. Their cost of producing a car was far less in Canada than the United States because of this health insurance plan. Why didn't it kind of naturally evolve that way here as it did so many other places?
You know, it's interesting. The American Medical Association was even more powerful than the Canadian Medical Association, and they were able to almost stop the creation of the Medicare program. The fiercest opponent to the creation of Medicare was the American Medical Association. The insurance industry, they weren't necessarily on the sidelines. They were not supporters, but it was the AMA that was leading the opposition to this. But our system was very comparable, very similar to the system in Canada up until Tommy Douglas and the creation of what became the Canadian system in Saskatchewan.
Meaning mostly nonprofit health insurance companies.
Right, exactly. And it wasn't until the 80s and 90s that a lot of the nonprofit insurance companies began to convert to for-profit status, and a lot of big life insurance companies, Cigna, the company I work for, was a traditional multi-line insurance company that sold property and casualty insurance and reinsurance and financial services. That company and Aetna was similar. They decided, well, we can get into healthcare. We can make some bucks over here. And they were for-profit companies. So that's
actually, maybe I didn't make it clear enough. In the Canadian situation, the insurance companies were almost all nonprofit.
and they were in this country initially.
But so when the fight takes place for government health insurance, there isn't a big not for-profit health insurance industry. But here, it becomes very important to the insurance companies.
It does. It does. In this country, we never, like Canada, had any debate that went anywhere to develop a national healthcare system. It has been attempted over many years, going back to even Teddy Roosevelt. But certainly during the Truman administration, Truman was really pushing for a system that would have been much like Canada's. And subsequent presidents have thought about it, but there's always been such entrenched opposition because of the power of the American Medical Association and the growing power over time of the insurance industry, certainly as it began to convert to for-profit status. So we never really got to the point that most other developed countries were able to get to in terms of having a national debate to create a truly national healthcare system.
And who drove the privatization of the nonprofit health insurance sector?
Two ways. One, a lot of the nonprofit blues began to decide that they could convert to for-profit status, and they felt there was some benefit to that. But also you had big companies like the ones that I worked for, or at least Cigna, that decided they could make some money in healthcare and moved into it. So you had some very rapid change from nonprofit to for-profit status.
What years are we talking about?
We're talking about late 80s through the 90s and the early 2000s. You saw as the blues, some of the blues began to convert, Blue Cross Blue Shield plans convert to for-profit status. They now, many of them, are part of a very large company called Anthem, which owns a lot of the Blue Cross plans that previously were nonprofit. There still are some in the country, a number of them, that still operate theoretically as nonprofits. Many of them, though, have for-profit subsidiaries. So they make a lot of money for shareholders and their boards.
All right, well, let's get back to the politics of all this. Joe Biden is in the race for 2020. And right now it's Biden versus Bernie. Maybe that will change, but in some ways it's a good thing because you have two very distinct views, especially on healthcare. One will argue, and I'm going to argue the Biden side here, that to take on pharma, to take on private and healthcare insurance companies, to move to Medicare for all and take on that war with Wall Street in a very important profit center for them, is going to throw that sector behind Trump. And if you think the paramount issue, which a lot of people think, is defeating Trump, then you don't want to take on that sector. And you need to compromise with that section of finance and try to fix the ACA to some extent, or you'll throw a massive amount of Wall Street behind Trump. And Wall Street already is kind of happy with Trump. He's between the tax cuts and deregulation of Wall Street. I mean, I actually don't know if it make that much difference anyway, because I think Wall Street kind of loves Trump. On the other hand, they might go for a Biden because the Obama administration was not that unfriendly to Wall Street. I mean, yeah, Dodd-Frank was passed and so on. But the truth is, Wall Street did very well under the Obama administration, and they might like a more rational Biden, Wall Street friendly, versus what a lot of people think is a pretty crazy Trump. So what do you make of that argument? Because I think that's what we're going to hear a lot of that argument.
We'll hear a lot about that, and I'm sure there's probably some truth to that. But I also know that a lot of the big corporate Wall Street Democrats are, they are concerned about this groundswell of support for candidates that are able to amass a lot of campaign money through small donations. Their power is being challenged, and they don't like that. So I think, but what Biden is doing is showing that at least the establishment Democrats are still very much beholden to Wall Street and to big corporate interest. And the other candidates are going to be trying to distinguish themselves from that. A number of them are already. It could be that there will be some money that goes to Trump that might otherwise go to some Democratic candidates. I'm not so certain if that's the case. We'll see. But I don't think that Wall Street necessarily has as much sway over Democratic voters as they once did, particularly with some of the candidates who are certainly shunning Wall Street and would be Wall Street's worst nightmare. Certainly Bernie Sanders, probably even more so Elizabeth Warren, and some of the other Democrats that have said they will not take corporate donations.
So what do you think is the significance of these elections?
I think they're very significant. I think, as we've talked previously, there's not any chance that Medicare for all will get through this Congress and be signed into law by President Trump. That's just not going to happen. So the elections couldn't be more important if this is to advance. And I'm of the opinion that the current healthcare system is not sustainable. It's going to collapse at some point. If it doesn't collapse, it's going to be a system that people only who are the wealthiest in this country are going to be able to afford care, and the rest of the population just simply will not be able to get the care that they need. We already are the only developed country in the world that rations care on the ability to pay, and that's only going to get worse. And I think you're going to be seeing not only more and more individuals and families support Medicare for all, but you're going to see increasingly businesses, small businesses, mid-sized businesses in particular. One of the other things that I have done is agreed to serve as president of this organization called the Business Initiative for Health Policy. And it's an organization that makes the business case, not just the social and moral case, but the business case for moving to Medicare for all. And representing businesses that can no longer afford to offer coverage to their workers. They're becoming increasingly uncompetitive in the global marketplace if they are having to experience year after year premiums they can't control. The founder of the Business Initiative is a business executive who is calculating that it now costs him $14 an hour per year per employee to offer coverage to his workers, which is ridiculous. There's no employer that can do this indefinitely in this country and still be competitive in the global marketplace.
All right. Thanks for joining us, Wendell. And I'm sure we'll talk again as the campaign develops. And but for now, that will be the end of this part of a segment of Reality Asserts Itself. And as I say, we'll talk many times as this unfolds.
Thanks for the opportunity, Paul. Thank you.
And thank you for joining us on the Real News Network and Reality Asserts Itself.